So in this video we're going to talk about knee extension, particularly in below knee amputees. As a physio, we generally harp on about knee extension, and there's many reasons why this is really important. Number one is actually the setup of the person's prosthesis. So a prosthesis is generally set up in 5 degrees flexion. Why this is really important is if you have 0 degrees or a straight knee, that prosthesis is going to be set for 5 degrees, which means that you're allowed to distribute that weight that you're using to walk through your patella tendon or your tibial tuberosity. What happens is if you're lacking knee extension, that is actually set in a greater degree of flexion. So if you've got -5 degrees of knee extension, it's set in 10 degrees, -10, set in 15. You can see where this becomes an issue because the greater flexion you have, you become less and less functional, and then all of a sudden you go from the potential of walking on a prosthesis to only having to use it for transfers. So you're lacking knee extension, what can you actually do? So first of all, you've obviously got hamstring stretches. So sitting in a long sitting position, you can reach forward, trying to feel that stretch through the back of your leg. Alternatively to this, you can actually use a bit of self-release techniques. So using a bit of sunscreen, moisturizer, whatever cream you have, basically you're just looking to reduce friction here. You can dig your knuckles in through your hamstring, you can really dig your fingertips through there. What I find though is a physio's hands become conditioned to massage, so they can do it for hours and hours and hours. Unfortunately, if you're new to doing this and you're just starting to do some self-massage for yourself, your hands can become quite fatigued. So an alternative to this that I like to recommend is using a metal pole, a spanner, something quite firm. You can put a bit of cream through your hamstring and you can actually use this metal pole to pull up against it, and this allows your fingers to take a rest. Now, once you've worked through the soft tissue stuff, so you've had the general stretching and you've done the soft tissue release, the third option that I really like, and I find that this is quite beneficial, is using a weight. So with that weight, you're wanting to place it over your knee or just above, and you're just sitting there allowing that weight to push you into that knee extension. The best thing about this is you get to sit there, watch TV, just try and relax yourself, take some nice deep slow breaths to take some of that muscle activity which is preventing that knee extension. On top of this, there's a couple of variations where you can use something that's quite heavy for a short sustained stretch, or you can go for something that's lighter and sit there for longer periods. So you can vary your stretches anywhere from 20 seconds to 3 or 4 minutes, depending on the weight and depending on how you feel. Now, one little tip is once you've been pushing your knee into knee extension, it can be really sore to get yourself back into flexion. So what I like to do is grab both sides of my knee and just bounce it a little bit, just to take away that initial pain of flexing your knee. Now, working on knee extension is really important for the early phase of rehab, because when you're in a lot of pain, you'll want to put a little pillow or a little towel underneath your knee. Now, it's really important to encourage you not to do this, because when you're lying there, although it feels good, you're really running the risk of developing a contracture. And once a contracture develops, it's really hard to try and compensate for that. So basically, early phase post-surgery, you're wanting to make sure that you're lying flat on the bed and allowing your knee just to sink into that bed and really work on some of those bed exercises that you'll be given, because it's a lot easier to maintain the extension than to try and develop it. Although your contractures will generally develop very early in the piece, they can develop as time goes on, because when you're learning to walk on a new prosthesis, there's going to be periods of time where you're going to be off your leg. So it's really important with your wheelchair setup that you're making sure that that stump board is in a really good position, because if you're sitting with your knee in slight flexion most of the day, that is a massive risk of developing some sort of contracture through your knee.